Today I would like to speak to you about benign prostatic hyperplasia, BPH, also commonly known as swelling of the prostate gland. It's a rather common condition in men after 50, and it causes incomplete urination, dribbling after urination. People often have to go to the bathroom more than once in a period of just half an hour to completely evacuate bladder. And in more advanced stages, men often cannot evacuate bladder completely, and there is always a little bit of urine left in the bladder. It's potentially a dangerous condition which may cause damage to the kidneys, because urine may back up all the way to the kidneys, and it also may cause other complications such as urinary tract infections. In even more advanced cases, men cannot evacuate the bladder, and they need to catheterize to let it out. And so today I would like to offer to you a treatment protocol that I find very useful in such conditions. So let us speak first of all about the nature of hyperplasia. And I would say that at the core of it stands the damp heat, where dampness is bigger than heat, and therefore it drives into the lower part of the body and builds up in the bladder and the prostate. In terms of the channels, obviously prostate belongs to the kidney channel, and another channel that we may want to consider, and rather we should consider, is the Yin Qiao vessel, because it's a chronic condition and it's been developing over a long period of time, and usually it happens after a certain age. So we're talking about cycles of 7 and 8, and so therefore it's definitely an 8 extraordinary condition. And two extraordinary channels that deal with yin stagnation are the Zhen channel and Yin Qiao. And as you know, they are actually a couple. The confluent point for Yin Qiao is kidney 6, and confluent point for Zhen is lung 7. And lung 7 is a coupling point for Yin Qiao point, and kidney 6 is a coupling point for the Zhen channel. And these two channels, they deal with stagnation of yin, and in particular Yin Qiao Mai has indications for incomplete or frequent urination, because oftentimes also men start urinating more at night. They have to wake up at night, go to the bathroom, and by the way, this is one of the first symptoms, frequent nighttime urination, that there is some sort of hormonal disbalance that will lead in the future to prostate enlargement. And by the way, urinating at night is definitely associated with the kidney channel. And so kidney Yin Qiao vessels are two channels that are implicated. And in terms of the 5-element theory, I'm going to write here our diagram. This is fire, earth, metal, water, and wood. Okay, and so we spoke about the kidney channel, and the water phase is very important in treating this disease. Another important phase here is earth. Why? Because there are two ways we can deal with dampness. We can drain. We can drain dampness or leach it down, or we can also transform. Okay, so we can also transform dampness, and this is more function of the spleen channel. Also, spleen channel builds up qi, and whenever we have chronic kidney deficiency, we definitely want to build up qi, to build up the kidneys. And finally, the last phase that is going to play a very important role in treating this condition is the mental phase. And this actually has to do more with another important diagram that we need to introduce here is the Chinese biological clock. And those who are familiar with my style of acupuncture know that I always like to put on top here heart. Why? Because in terms of the Chinese biological clock, heart channel is open at 12 noon, and gallbladder channel is on the bottom of the diagram because it's open at 12 midnight. And I'm talking about solar time, not the time that you necessarily have on your clock. And then from here on we have gallbladder, liver, lung, large intestine, stomach, spleen, heart, small intestine, bladder, kidney, pericardium, and sanjiao, right? And the reason why metal phase is so important is because when we look at two channels that are associated with the metal phase, they are directly opposite to the kidney and bladder channels, which are associated with the water phase. Okay, and when we have a deficiency in either kidney or bladder channel, it is always a good idea to focus our attention on the metal phase to build up the water phase. Okay, so metal phase is very, very important in strategically important in dealing with incomplete urination. In fact, you may know from your acupuncture textbooks that many metal points, many points on the lung channel have function of disinhibiting urination. Okay, now let us go back to the Yin Qiao vessel. And just like I said, this channel has ability to treat stagnant water in the body. And in fact, the Great Compendium of Acupuncture offers a protocol to treat incomplete or frequent urination. And this protocol consists of the opening point, confluent point for the Yin Qiao channel, kidney 6, which by the way has the ability to treat incomplete urination. It's followed by Sanjiao 1, which is a metal point on the Sanjiao channel. And by the way, Sanjiao channel is also very important to consider when we treat incomplete urination, because Sanjiao channel is the primary channel to deal with the damp heat scenario in the body, because it deals with water and fire elements. But here you can see from my presentation that I'm speaking primarily about the water, because dampness is the predominant factor, at least in this presentation. Okay, so Sanjiao 1, next point is Spleen 6. Doesn't have a five element correspondence, but it's a point that connects kidney channel, liver channel, and spleen channel, and it has very powerful effect on the lower part of the body, the lower burner, and it can invigorate blood, which often is a complication of the benign prostatic hyperplasia, and it helps to disinhibit the lower burner. Spleen 6, spleen 9 is the next point, and this is a water point on the earth channel, on the earth channel. So it has both water and earth characteristics, and this is a great point to disinhibit the lower burner, and it also deals with many dampness scenarios in the body. And here, of course, if we are to digress from the original prescription in the Great Compendium, we can also consider points such as kidney 10, because they're also water points on the yin channel, and also liver 8, another great point to disinhibit the lower burner. And the final point on this prescription is large intestine 4, which is a source point, yuan source point on the metal channel. And source points are said to closely related to the Sanjiao. And another function of Sanjiao is transformation of qi. And what is meant by transformation of qi? We are familiar with the defensive energy, nutritive energy, constitutional energy, and these energies are constant adjustment to each other. They transform, nutritive energy can transform into the defensive energy, and some people would say that nutritive energy can also replenish the constitutional energy as well, etc. And so this process of transformation is helped by the Sanjiao and the source points, all 12 source points participating in this process. And therefore, anytime we have an excess or deficiency of a particular channel, we always want to add a source point, because it treats excesses and deficiencies of the channel regardless. And some people would say that large intestine 4 is especially powerful point to transform qi, because large intestine is a point located on the metal channel, right? And so metal transforms qi. And you can also see that again, large intestine channel is opposite to kidney channel, and some people might also say that large intestine 4 is a great point to replenish kidney qi. Okay, and so the final point in this sequence is lung 7, which is again, it's another point on the metal that belongs to the metal phase, and it can help us to disinhibit dampness. So this is a complete treatment strategy that is offered by the Great Compendium of Acupuncture. Now, another aspect of working with there are two more components of working with the extraordinary channels. And the first component is that we need to understand that these channels are open, they open the energy in time. Just like 12 regular channels, we know that gallbladder channel is active at midnight and heart channel is active at 12 o'clock in the afternoon or noon. Extraordinary channels have also a pattern of opening and closing. And so if you really want to tap into the energy of kidney 6 and Yin Qiao Mai, we need to know exactly the schedule when it's open. And the system that is familiar and it's presented also in the Great Compendium is called the eight methods of the divine tortoise. You may have heard of it as Ling, Gui, Ba, Fa. Ling, I'm gonna write it in Chinese for you guys. Ling is a divine. Gui is a tortoise. Like in Gui Ban, those of you who study herbal medicine, they know of Gui Ban. Weird looking character. Ba, 8, and Fa method. 8 divine tortoise, 8 method. Okay, and you can learn more about it. There is plenty of information online how to apply this method in your practice. However, as we know, it's not always possible to schedule your clients exactly at the time when Yin Qiao vessel is open, and the way to deal with this would be to needle the confluent point of the Yin Qiao vessel in its coupling point, lung 7, because it already taps into the those 2 points that tap into the Yin Qiao energy, and Zhen vessel, right? And each one of these have a yin-yang pair, right? So Zhen channel is coupled as a yin-yang with the Du Mai, and Yin Qiao is coupled with Yang Qiao. And so we can, in addition to this, we can open the bladder 62 and small intestine 4. So kidney 6, lung 7, small intestine 4, and bladder 62. You may have seen this in acupuncture school. This is how often extraordinary channels are opened, and I'm just giving you the reason behind it, because oftentimes when we treat the particular extraordinary channel, it's not necessarily open, and the effect of using the confluent point is going to be significantly less than at the times when the channel is open. And therefore we're gonna open 3 more points in addition to the confluent point of the channel, and that would allow for these channels to communicate because they are all connected. And next, and then we can tap into the qi of the extraordinary channel that we are interested in. So this is the first aspect. And second aspect, I'm gonna write it here, here. And the second aspect of dealing with the extraordinary channel is we want to needle some points in the trajectory of the channel. And so opening this channel in real time and also opening the trajectory of the channel will communicate to the body that we are working with the particular extraordinary vessel. And as we all know, Yin Qiao has the following points. It has kidney 2 as the first point, it has kidney 8. That's another great point that should be considered in treatment. Some books, not necessarily books in English, but some books list stomach 19 as the point on the Yin Qiao vessel, stomach 12, and bladder 1. And in particular, we're going to be interested in kidney 2 and kidney 8 for this treatment. And you see, kidney 2 is a fire point on the kidney channel, and so it has a great ability to treat damp heat scenario, and it's also going to be very effective in treating symptoms of yin deficiency. And so if our damp heat is complicated by the empty heat, this would definitely be the point of choice. In addition, this point also has indications for incomplete or difficult urination and frequent urination. Kidney 8 can also treat incomplete or difficult urination, and this point is also associated with the penetrating Chong Mai, and therefore it would be of favor in cases when we have qi deficiency or blood deficiency, which is not that common in men unless they go through chemotherapy or radiation. So I would suggest we can choose one of these points to add to the Great Compendium of Acupuncture prescription here. And that would be one way to deal with the symptoms of frequent urination. Now, in terms of the branches of the treatment, we may have also qi deficiency, or stagnation, which may lead to blood stagnation. So if there's qi, and I would contend that qi stagnation we are dealing with in terms of spleen channel here. So this we took care of, but blood stagnation is treated best by bleeding, bloodletting techniques. We can prick purple capillaries. We want to avoid bleeding varicose veins, but we definitely can bloodlet, squeeze a few drops of blood from purple blood vessels along the spleen, kidney, liver channel on the leg, all the way from above the knee to the foot. And we can also do wet cupping on the sacral region, and that would help us to alleviate blood stagnation of the problem. And if there is qi stagnation, my go-to is direct moxa on the back shoe points. I usually use a small slice of ginger to burn it in order to avoid blistering, which is not desirable. And there is a small video on my direct moxa techniques. You can find it in the link below. And so this is my presentation for treatment of benign hyperplasia. Thank you, and I'll see you next time.